The gap between vaccinations globally and on the African continent is increasing despite the best efforts of African countries because of vaccine inequity.
The World Health Organization says 225 million coronavirus vaccines are urgently needed in Africa in order to prevent nearly 90% of countries on the continent from missing the target of vaccinating a tenth of their respective populations before the end of the year. This was disclosed in an online brief by the World Health Organization's Director for Africa, Dr. Matshidiso Moeti. Dr. Moeti said as Africa heads towards a sad milestone and as a third wave looms, many African lives are at stake.
COVID-19 cases on the African continent will soon pass the 5 million mark, and this virus has already claimed 133,000 African lives. In the past 7 days, 88,000 cases were reported, an increase of 19% over the previous week.
Less than 1% of the over 2.1 billion COVID-19 vaccine doses administered globally were received by Africans, with just 1 in 50 of the continent's nearly 1.3 billion people having received the jab. The COVID-19 vaccine rollouts have been exemplary in some African countries, and 8 African nations have already used all of their COVAX doses, yet 9 countries have given less than a quarter of their doses and 15 countries use less than half. Factors leading to delay include a lack of funds, trained professionals, hesitancy among the population to get the vaccine. In some countries, insufficient planning, including targeting priority groups and remote populations, are holding back the rollout. However, Dr. Moeti believes that all hope is not lost.
The US President Biden's plan to purchase and donate 500 million Pfizer vaccines to 92 low and lower middle income countries and the African Union is a monumental step forward. This comes as we see other countries such as France also making tangible deliveries via COVAX. So the tide is starting to turn.